Well, with me today is Dr. Perry Nickelston, and really excited to have you on, Dr. Perry, and really dig into what your practice focuses on, which sounds like your background too, based on what I'm reviewing, is pretty diverse as well. But you focus heavily on the lymphatic system, but there's a broad background on there medically.
Yeah, well, first of all, thank you very much for having me on the show. Yeah, I mean, I guess that's, I don't know, partly by accident and design, I guess you might say. So I've
Accidentally
always loved learning and forever a student, and I love just to look at different approaches, different concepts. I don't like specialization, and it's been a really great journey to look at a lot of different things and see how they relate to each other and put puzzle pieces together. It made it a lot more exciting for me in practice to begin to have a lot of different ways to look at a problem that came into my door. Yeah. So it's been fun for sure.
That's awesome. Well, it's great to have that. Well, you kind of need to have that curious mindset in order to be in medicine.
I think so.
What kind of started? What was the catalyst down that path for you to go down the medical practice?
Yeah, well, like a lot of people, my own pain and suffering, or someone in your life that you really care about, and you typically gravitate towards what helped you or a person that you love. For me, it was chiropractic, and I hurt my lower back like a lot of humans do. This is back in the late 80s, and heard it bodybuilding, doing a squat and feeling a click and being stupid, and just kept squatting and couldn't move the next day. And my training partner was like, "You should go see my chiro." And I'm like, "What? Chiro what?" I didn't know what it was.
Yeah.
And went in, the guy helped me stand up again, which was great. But at the time, I didn't consider becoming one. It was only years later that I had a career change course in my life that I decided to say, you know what, maybe I can go do that, because it really helped me a lot. So my beginning journey into healthcare was through chiropractic, and that's my license degree to be able to do what I do. But then that was the stepping stone to studying a lot of the other disciplines beyond chiropractic.
Okay. So I guess, was it your curiosity that kind of went down that rabbit hole of discovering the lymphatic system and really understanding and realizing the importance of it?
Sort of. That one honestly was through getting really sick 5 years ago with an autoimmune disease that they really still don't have a name for, like a lot of people.
Yeah.
I was just suffering, and everything that I've studied up to that point was not helping. And every type of doctor that I saw was not helping. Mostly a medical, Western medical approach, because I was having a lot of infections in the body, and with that came a lot of surgeries or medications and stuff like that when you have infections. And unfortunately, that made me way worse, and I was deteriorating very quickly. And it was my own necessity of really wanting to survive, quite frankly.
Really?
That led me to look at something that I said, somebody has to be missing something here, man. You're not supposed to feel this sick for this long. I mean, it's okay to get sick, but you're not supposed to stay there, right? And especially out of nowhere with no explanation.
And you were a relatively healthy person prior to that.
Yeah, and here's the thing. I thought so, but now that I look back in hindsight, there were subtle symptoms that I was overlooking that I just didn't know to look for in relationship to lymphatic system issues or systemic, what they call systemic full body chronic inflammation, that you don't really notice. And now that I look back, I'm like, wow, of course it was right there. But once I found that system and started to work that system, it made a profound difference on my health and brought me back where nothing else would. And then that was the kind of calling for me at that moment to do what I'm doing now with lymphatics, but also tying that system to all of the other systems in the body that I was studying at the time. Yeah.
So what other systems were you studying at the time?
A lot of musculoskeletal in our world with chiropractic. So everything you could think about muscle and joints, and then fascia, the connective tissue system of the body. Okay. And so I was in that world. So everything for me was related to musculoskeletal or / nervous system, right, through the nerves of the body. And mostly peripheral nerves through the spine, and then the nerves as they go into the arms and the legs. That's kind of the root, you might say, of chiropractic. But then that led me to look more at the brain and neuroscience and pain science. So I started to look at the brain. But I never was really looking at the lymphatic system / immune system of the body. And it took me getting really sick to go down the road of looking at the immune system. And then that's when I saw the neuroimmune connection, the nervous system and the immune system connection. And then now one of my central tenets of my teaching is that no system in the body ever works alone. Right. They never get injured alone, and they never heal alone. So it's all of them. So now I learn about every single damn system that you have, but more importantly, how they relate and communicate with each other. That's the key.
Yeah, it's fascinating. And it's amazing to me that we're kind of, it seems at least on the outside looking in, where medicine is starting to head a little bit, where you hear terms like integrative medicine or functional medicine and things of that nature. Would that be categorized accurately of what you're doing kind of in that territory?
I guess you could say that. Functional medicine has its own little niche. They deal a lot with, autoimmune chronic disease, which I do now as well. But they come at a standpoint a lot from supplementation and nutrition. So I still mix a lot of assessment and manual therapy interventions in my work, as well as the nutrition and supplementation. Because here's the thing, I found that the nutrition and supplementation wasn't helping a lot of people either. Then you have to dig deeper and figure out why, because so they're trying to add nutrients and supplies into the body that are deficient, which is good, but they weren't really looking at the underlying toxicity in the system that's there that you have to remove first, and then getting into the root of, okay, well then why did these systems go ballistic and go crazy at the same time? So I guess you could say, people say, well, what do you do? And I'm like, I don't really have an answer, because it's not one thing. I don't say I'm a chiropractor, because when I say that, people go to the mental file folder of what a chiropractor is, and they think neck and backs. And I'm like, I don't do that anymore. And then, I don't say that I do massage or soft tissue work, because then you go there. I do anything and everything that needs to be done to help somebody get better. And honestly, what I've worked for is not necessarily saying that I do a particular profession / technique. I'm trying to form a concept of looking at the body in relationship to figuring out what technique or what profession might be the best for what you need under that concept, right? If you know what I mean. So the concept of the approach, because if you know the concept, you can create 1,000 different techniques, which means I don't care what technique you use. If your concept is wrong, it ain't working.
Right. Yeah. Like you were saying around the supplementation, things I've heard about, like gut health, that you can be eating the right thing and take the right supplements, but if your gut is jacked up, you're not going to absorb the nutrients.
Yeah, exactly. So that's a classic one where people have malabsorption syndrome, aka leaky gut, where you can't absorb things well, even the good stuff. And then to try to heal it, what happens is that at least in the USA and Western medicine, is they think more is better. And then you leave with a bag of 25 different supplements
Right.
to heal your system. And it's cost you thousands of dollars and, thousands of dollars for testing, but you're putting it into a system that is so sensitive that even though it can be helpful, it does the opposite. And a lot of people are just overloaded. And what you're doing is very often too much, too fast, too soon. It takes a while for your body to get to this breakdown point of chronic disease. It doesn't happen overnight, even though it feels like it does. You don't just wake up with rheumatoid arthritis, right?
Right.
It takes years, if not decades, that goes back 20, 30 years sometimes. And you can't restore it that fast either. It takes a while to do that. And that's a hard concept for people in today, where you can get whatever you want with a swipe of a finger and it's there, and sometimes in a couple of hours.
Right. Exactly. And then you start correlating that to your own wellness, and you're like, well, I'm doing all these things. It's A plus B plus C equals my desired result, right?
Right.
That's simplistic, but it's not.
I mean, just because you're doing all these things that can help you get better, I always thought, then why am I not getting better? So then I started to think that way. So my initial concept was, I'm doing all these great therapies to people and they get better, but they don't stay better. What's up with that? That was my first thing. And then I started to, let me make sure that they're actually doing what they're supposed to be doing, because sometimes they're not.
Yeah.
But the majority of the times they were. And then I had to play with it. Well, maybe I'm giving them too much to do, right? But I found that that was something that was missing, right? And then I thought, okay, well, why can't I give patient A this protocol for their knee or their gut, and they do great, but I do the same protocol for patient B and they don't change, or they get worse? And that's because those two body parts are really not the same, because patient A and patient B are not the same. Those body parts have been through a complete separate journey, even from conception. The journey was different. Yeah. That's your genetics, for goodness sakes. And your life story and your life history up to the moment you walk in my door has a profound impact on my so-called technique and success with what we do.
I mean, you make a great point on, I've heard personalized medicine and we're all unique, right? I jokingly say walking chemistry sets. But I hadn't thought about it from the context of what you just mentioned, where, even from inception, like we have the same anatomy, yes, heart, lungs, etc., but it's going through different terrain, different experiences. Geographically,
exactly.
Foods,
encoded completely different. And now we're looking at the experiences that your mother has gone through influences your health when you come out. And
do you like her emotional aspect, or
her stress level does that, right? And then that carries on to you, but and you got no choice in the matter. It is what it is.
Yeah, it's just what you're given, what you have to operate within. So when it comes to like the lymph system, like the biggest thing I was wondering is, like, why is this not discussed more? At least from my seat, it doesn't seem like it is. And even, related to what you're saying, is your worldview on how you look at the whole body is interrelated and interconnected. And you have to look past the step 1 to step 5. Like why is that not viewed more within the medical community?
I'll tell you what, man, I ask myself that same damn question every single day. And it's very frustrating, because I'm like, don't people see what I see, right? But then I have to step back and I think, I didn't see it until 5 years ago either.
That's a fair point.
And that's because I didn't have a reason to reframe. Right? I'm just kind of, it was never really talked about in the past, which is what I'm trying to change in relationship to lymphatics, because it's a system that it's just not on the radar in relationship to pain, it only comes up when somebody has cancer. That's usually the biggest time you hear lymph, because lymphatics are designed to kill cancer. It kills cancer every day. You don't even know it does it. But it can spread cancer as well. And that in and of itself should tell you how critical the lymphatic system is, if it can send cancer any place it wants in the body. Wow. And then the other time is when you have a body part that's really swollen compared to every other body part, called lymphedema. But in medicine today, we don't really look at it, but it's something that has been looked at in the past. Like if you go back, I love to look at medical archives from 100 years ago or more. Because you see, these guys didn't have all this fancy equipment where you could take things down and look at it on a single cell level. They had to think and look at relationships and concepts. And then they found lymphatics, a long time ago. And then it's discussed a lot in the classics. It just got buried in like a vault, and nobody really looked at it. The one who got closest to bringing it to the forefront, honestly, was probably the founder of osteopathic medicine, called Andrew Taylor Still. And he was a medical doctor who lost most of his family to disease and was very frustrated at the medical model. So he said, I'm just going to make my own damn model, I have mad respect for that. And then his whole premise is nerve, blood, and lymph. That's his thing. Yep. And he talked about it a ton back then, of the fluids of life. And anatomists were talking about it hundreds of years ago too, an Italian anatomist. But it just got shelved, hasn't really been looked at that much. It's starting to get better now because research is catching up a little bit to the tools that modern medicine has available to observe the lymphatics, right? Okay. And in that model, if they can't observe it under a scope and do a quadruple double-blind study, it doesn't mean anything. So now they're starting to focus on that a little bit more, which is good, especially since they've actually been able to change their paradigm of saying that the brain was an immune system privileged organ and didn't have lymphatics in it. And now they know that the lymph is a significant player in the brain in relationship to brain health and toxicity.
Really?
So that was a big oopsie daisy moment where, well, sorry, we missed that one, guys, right? It's kind of
minor
like
detail.
Listen, are you really going to listen to the same people that years ago told you that the brain can't change itself? Mm-hmm. I mean, they made some of the dumbest things in the past in relationship to medicine, but we follow along and just believe what they tell you. And you need to keep that in mind, that what you think is true today is probably completely freaking wrong tomorrow.
Yeah.
That's how science works. That's how looking outside the box works. But the more we get into science and medicine, the more we hold on to things, mm-hmm. and we don't want to look at, and that gets dangerous right there.
Yeah, almost dogmatic.
Yeah, I mean, you have this reflex paradigm that you fall back on, and there's a lot of egos on the line, right? That when you're challenging something that the people have based their whole existence on, and then to tell them that it's wrong, they fight for that. And so with the lymphatics, I think what's probably bringing to the forefront, honestly, is we are sicker as a human race now than ever before. Mm-hmm. No matter how much technology we have or better of this or this, we're not getting healthier, we're getting sicker. We can do pretty good job at acute trauma care. Like if I'm about ready to die, I want Western medicine. But if I've got a chronic disease, I don't want your ass anywhere near me, because they have no idea of how and why, right? Their answer is still the same. I'm just going to throw pharmaceuticals at you.
Yep.
And you can't do that with this thing, because there's so many different factors that cause this thing to build, and then a catalyst sets off. It's not like an infectious disease where germ A causes this result. Let me go after germ A, and then the end result is fixed. It doesn't work like that in chronic disease. So they're finally expanding and saying, okay, there's got to be something that we're missing. And I call the lymphatics the new fascia. Because there used to be a time as well when medicine didn't recognize fascia played any important role. It was just tissue that they cut through to get through to their target below, sew you up, and then you're good.
Right.
But now you can't read anything without seeing fascia as a player in something. And then the lymph is the same way, that it's exactly like fascia. I think it's even more important than fascia, in my opinion. I think it's the most important and neglected system in the body that medicine is not focusing on, or that people don't pay attention to.
So we talked a lot there's so many things that I can pull on that I completely agree with you on, but
a lot of threads there, right?
Yeah, a lot of threads, but could we take half a step back and define the lymphatic system, which you kind of started to touch on at the end there?
Sure. Yeah, that's a good idea. So here's the thing about the lymphatic system. It's a significant player, if not the most important player in your immune system. So when anything comes into your body that's not supposed to be in there, or your body wants to kill off, the lymphatic system comes into play. Your immune system has one job. It kills stuff. That's it, right? And when something comes into the body, like a bacteria, a virus, toxins, parasites, cancer, exotoxins, things that come from outside of the body, inside of the body, and what we call endotoxins. Endotoxins are your own metabolic waste, which means that your cells normally dying every day, which are billions, just through the process of degeneration and life and decay. That's waste that becomes toxins. Like if you go to the bathroom in your house, that's waste. You want to flush the toilet to get rid of it, because I don't want that stuff in my house. And It's the same thing in your body. Your lymphatic system is your toilet. It's supposed to flush those things out. It's known as the sewage system of your body, and it's a first-line defense of fighting things that go into your lungs, through your skin, and into your mouth through your gut, right?
Okay.
And we know that 70 to 80% of your immune system resides in your gut, in your abdomen. And it's no mistake that Mother Nature put the majority of your lymph right there as the first system that it comes across to fight the invaders that leak through the gut. So if you have a gut problem, you got a lymph problem. Hard stop, period, end of discussion, right? Like, it's there. So it's part of your immune system, but it's also, which many people don't know, a huge player. It's the second cardiovascular system. It works directly with your heart and your venous system, because the lymphatics tie into and work directly with the veins of your body, the venous system. And the veins are what goes back towards the heart, bringing back its own fluid and toxins and deoxygenated blood with a big toxin, which can be carbon dioxide. Comes to the heart, then the heart takes it to the lungs, then it goes back to the heart, and then it goes out again. So the lymph is a big player, because the lymph dumps its fluid into the veins at the neck. And then the veins take their stuff plus the lymph stuff to the heart. Then it goes back to the heart, and it gets pumped out through the arterial system again as what they call blood plasma. So it changes a name when it gets that part of the circulation. So if you have a circulation issue with the lymph doesn't move well because it's fluid, it can become stagnated and overloaded or backed up, just like your toilet. Or you have poor venous return because of lack of movement in the body. Then you have backflow and pressure. When you have backflow and pressure, then you have to increase pressure to make up for that. And one way that your brain can do that is, well, I've got an easy way to do that. I'm going to raise blood pressure. And then your heart pressure goes up to try to make up for the loss of fluid pressure in the lymphatics. So you've got lymph everywhere, a significant amount of lymph related to the heart in and of itself. And they're seeing that cardiovascular disease is intricately tied to lymphatics, because lymphatics are also tied to the metabolic structure of the body in relationship to how the cells are able to receive nutrients and glucose. So you can't separate these pipes. Just don't stop in one place.
Right.
They mix all over the place, and that's the big picture. But now in medicine, if you got a heart problem, well, then they just go to the heart, right?
Right.
And they're just trying to take care of that pressure, as opposed to maybe looking at the other dynamics that go in conjunction with that. Does that make sense?
Yeah, it does. I mean, and as you're writing and before you said it, I wrote down heart disease linkage.
Yes.
And based on what you were describing, and I probably couldn't repeat it, but it definitely would seem like it would make sense that it would be correlated to that.
Well, one of the guys I learned from is Dr. Lemole, Lemole, who was the person who did the first heart transplant in the U.S. And he wrote a book about diet and lymph, and he actually stopped doing a lot of the cardiothoracic work and started concentrating more on nutrition and lymphatics to help heart disease. Bro, the dude puts new hearts in people, for goodness sakes. So I think he knows a little bit about how it works, and with lymphatics. So I learned a significant amount of information from him in relationship to the heart. He's got a good book that's out. It's a little bit older, but it's still testament to true. Was nutrition and diet related to lymphatics in the heart.
Okay. And that was Lemole,
Lemole, Lemole, I believe.
Okay.
Yeah. Let me make sure I got it right, but I'm pretty sure that's right.
Yeah.
I got so many resources for lymph, it's not even funny.
I'm sure. So what would be an example of me or somebody listening? Like, how would you know you've got a lymph issue?
That's a great question. So here's where I throw out my joke, but I'm not really joking. Everybody has a lymphatic system problem. They just don't know it yet.
Right.
Which means that the system is significantly overloaded. It's just so many toxins that it has to deal with, on more coming in than ever before in existence. Not to mention that it just being backed up, and then them not knowing that it's a system they actually need to take care of on their own.
Yeah.
Right. It's designed to be able to function on its own without intervention, but this is too much stuff going on these days in relationship to toxins and stress and trauma and tension in the body, because stress and trauma causes tension in the body. Lack of movement causes tension in the body. When you have excess tension in the body, you have decreased fluid motion in the body, right? So tension decreases fluid dynamics. And so it's very easy for me. Like, if you're standing in front of me with my office asking me for help, I already know it's a problem, because I only see the worst of the worst. Like, I'm the guy you knock on the door when you try a lot of other stuff and you're looking for something that
it's like a Hail Mary.
Got to be more happening. So I'll assess your lymph. It's used 99.9% of the time. It's going to be a factor for people. But because it's so significant in what it does, it can be linked to anything that you name. Like, you name a condition, I'm going to say yes. But the biggest ones is probably going to be tiredness, fatigue, brain fog, lethargy, a lot of skin issues that you get, acne issues, psoriasis, rosacea, any skin stuff. You get migrating pain in this joint today, pain in that joint tomorrow, inflammatory conditions, gut conditions, chronic pain type issues. And then now they're linking at least the gut-brain connection to neurodegenerative disorders of Alzheimer's and Parkinson's, and toxins in the brain, which will be linked to the ability for the brain to have fluid flushes in the brain for lymphatics and what they call cerebrospinal fluid. So I think they're going to see more stuff linked to it. That's why I use the analogy of a body aquarium, like a fish tank.
Yeah.
Because you're mostly fluid, right? So the cells in your body are in a fluid-filled environment. And they're only going to function as well as the fluid that they live in, like a fish. Like, the fish are only going to live if you take care of the water in the tank. That's it.
Period. Yeah.
You can feed the fish, no problem, and the fish will eat it, and then they're gonna poop, right? And then that's what your cells do. You feed them nutrients, and your cells poop. And then you need to get that poop out. And it's the same thing with the fish tank. So if I don't keep that pH level right, and I don't have that water has to move, you got that water moving, and then you don't see the filter system in the tank. It's stuck up underneath all those pipes, and you got this filter and this filter. It's out of sight, out of mind, just like medicine thinks with the lymphatic system. That if that system begins to deteriorate, slowly the water begins to change color. It's not crystal clear anymore. It gets like green. Then you grow stuff on the glass, and then it gets biofilm in there. And that's what happens to the human body. The bacteria and the viruses wrap themselves in protective biofilm. And then you have fish that start to get these weird looking freaky things on it, right? And then they end up like this, right? If you look in the tank, they're like this. They're really trying to struggle for what?
Yeah.
Oxygen.
Yep.
They're trying to struggle for oxygen when you see it. And that's what your cells are doing. They're starving for oxygen, and they can't get it because the environment around it won't let the oxygen get to the cell or to the fish. And they have the nutrients that can't get in there. So they slowly begin to die, and you can't make new cells that work, and you're sitting in your own cells. So no wonder you're going to get in an inflammatory state. So the body actually swells you up to protect you. So you get fatter, you get puffier, you get allergies, asthma, you get leaking, you sneeze, you drip, you cough. Those are mucus is protection. That's what it is.
Okay.
Right? And that's what was happening to me. I was getting a lot of urinary tract infections, lung infections, kidney infections, prostate infections. My body was overproducing these protective mechanisms. I was clearing my throat all the time. I was sniffing all the time. And that was a response to a lymphatic system that was overloaded and dysfunctional. So what I tell people is this: modern medicine just goes in and says, we need to give you a new fish. And then they take the fish out, and then they put new fish in there, and then the fish do well for maybe like a couple of days, and then they start to get the same damn thing.
Right.
Or what they might do is they'll take the fish out, and then they'll change the water, and then they'll clean the glass. They'll put all new rocks in there, all new castles. They'll put all new fish, all new water. Looks beautiful. You feel great for a little while, but then you didn't do anything with the filter system. And then 2 weeks later, same stuff shows up, right? So it's not the fish's fault. It's not the cell's fault. It's the environment that it's in. So there's a classic line in epigenetics where, it's the environment that determines what happens to you, not so much your genetics. The genetics loads up the gun, environment pulls the trigger. And there's another one that says you cannot get well in the same environment you became ill within. I'm going to say that one more time. You cannot get well in the same environment you became ill within. So you have to look at what's your environment, your internal cellular environment, but then you have to look at your external environment, inside the body and outside the body. That's the toxicity realm. Right? Not even just physical toxicity, but mental toxicity.
Mm-hmm. Yeah.
That's the emotional link to that. I mean, you could go home to somebody who's an absolute blood-sucking negative vampire that is going to affect your health. It happens all the time.
Yeah.
Or that's what social media does.
Yeah. I mean, the mental aspect is definitely a massive contributing factor.
Yeah, it's huge. So, those are really, really what I'm trying to get people is that all I want you to do is make sure the tank works as well as it can. And it doesn't mean that you're not going to get sick. It doesn't mean that you're not going to get hurt or that bad things can happen. I mean, that's just part of being a human being, and then life stuff just happens.
Sure.
But your chances of it happening significantly decrease, or if you do get something, hopefully it won't last as long as it could, or it won't spiral into being a lifelong issue, or what we call polyautoimmunity, where you got 3 or 4 different things, or you have many what they call comorbidities. There's a lot of different factors that are happening at the same time, not just one. And then that's fish tank stuff. Listen, if you've got 4 or 5 different things going on, that's a damn tank problem. That's what that is.
So you mentioned, it's an environmental issue, internal, external. How do you go about doing an audit, so to speak, to start that, grooming or fixing your environment?
Yeah, it's a great question. So it's going to be different for everybody, right? Because not everybody responds to the same environment the same way. A lot of that environment, at least from the emotional side, is a cultural thing. It's a perception thing, based on your prior history. Because what may stress you out is like, me, that's no problem at all. I'm good to go, right?
Right.
That one you have to take a little bit of ownership of. So the emotional side, I usually tell people you need to do a checklist on your work life and your home life and the 5 people that are closest to you in your life.
Yeah,
right?
Top 5,
including yourself. So Jim Rohn, a motivational speaker, once said that you're the average of the 5 people you spend the most time with.
Right.
And then I changed that up and I said, you better make it 4 because you're always number 1. You spend the most time with yourself. And
you
then
can't get
we're
away
the most
from
toxic to ourselves, right?
Yeah.
But then the biggest thing that I usually tell people to begin to take care of is just their external environment in relationship to, one, their habits of movement, because one of the primary things that gets fluids moving in your body, like lymphatics and the venous part of your blood, is movement. So a lot of people don't move a lot, and they're very sedentary. And I usually say, if you can add some variation, variability, and variety into your movement and just start walking more, you'll go a long way towards improving that stagnation environment that you're in. Another one is just observing your breathing, because breathing from in the nose primarily and through a muscle called your diaphragm, it changes pressure in your abdomen and in your body, and it moves fluid based on pressure. So you can say, hey, notice, am I actually breathing at all? Am I under so much stress that I'm not breathing? Am I just breathing in through my mouth all the time?
Yep.
Like a hyperventilation in a way.
Which dehydrates you.
Yeah. And then, or do I sleep with my mouth wide open, which most people do? And you just start to pay attention to your movement and your breathing. Then the other one is you start to really focus on one of the biggest one, which is just, what you stick in your mouth and how you react to it.
Yes.
Right. Not only quote unquote, I think most people know what they're not supposed to eat. I mean, we know it. I don't have to tell you not to eat a freaking donut and a Big Mac, right?
Yeah.
But I need you to pay attention to the other stuff that quote unquote is supposed to be good for you, but it might not be good for you if you're in a state of inflammation, where an example is you can eat 3 or 4 peppers, but not feel great. So that means that your body is having this sensitivity reaction to the peppers that way. So it's something that, maybe you'd eventually be able to eat them again. You just have to be aware of right now, your body just gets sent off a little bit. So it takes more awareness from that standpoint. The other one is, the quality of the air that you're breathing. Do you actually go outside much at all? If not, right? Then your blue light that you're always around, and you have something laying on your body like your phone or just like all that sort of stuff. So there's many different ways that you can begin to pay attention to it when you have the awareness too. And then all this other one is like what you put on your skin. That's a big one, because the majority of the lymph in your body resides at your skin, in your neck, and in your abdomen, in your gut. And there's so many different creams, gels, ointments, shampoos, makeup, all these things that people put on their skin.
Yeah.
Every day, thinking, well, it's got to be good if the FDA sells it. First of all, not so much. And then, because everybody's a little bit different.
Right.
But it's also what they're finding out is that, I was talking about this today with someone, is that even if you put a single thing on your skin that the FDA says is cleared and not toxic, well, what happens when you mix that with 4 other different things that you're putting on your skin.
Yeah.
So they didn't look at how that chemical reacts to what's in the other 4, because you just made some brand new thing that nobody's ever seen before because you put 4 different things together. You don't know what the hell you're going to get. It's like jambalaya, for goodness sakes. So I don't know what you're going to get. And I think that we're going to find that a lot of the stuff that we have as human beings today, from, you know, you got stuff on the new carpet, you got the craps thrown into your sofa, you got stuff in your new car. Burning candles will just take you down quick, fast, and hurry. That's just toxicity 101. Air fresheners in your car, all those things, you know, it smells good, but it's probably killing you slowly, right? But somehow we don't want to see that. But nature's telling you, you better take a look, because I'm going to make you sick. I'm going to make you really sick.
Yeah.
And that's what's happening.
Yeah, and I mean, we can attest to that to a degree with our family, with some of the sensitivities and food allergies and asthma.
Think about that for a second. Why in the hell are there so many food allergies right now? And why are kids 10 years and younger getting diabetes, for goodness sakes? Or they're getting diseases that shouldn't hit people, first of all, at all, but they're getting it at 10 when they're not supposed to have it until 40.
Yeah.
Right?
Yeah, 100%.
Something is not right.
And everyone just keeps ringing the alarms that something's not right, but the broader community or the influencers aren't doing anything about it other than just ringing the bell, and then coming up with other solutions that aren't really like solutions at all. It's just more of the same.
Yeah, well, I can tell you one thing. It ain't going to come in a pill.
Yeah.
That one thing I'm going to tell you right now.
And it kind of circles back to, I think, all of our own impatience with the solution, that it needs to be quick and easy and work. And to your point earlier, you know, if it took you 10 to 20, 30 years to get to that point, it's going to take some time to uncork that thing.
Yeah, you're going to have to, here's the thing, pain, right? People always ask me, what does pain mean to you? Well, my definition of pain is this: be it physical or emotional, acute or chronic. Pain is a request for change. I'm going to repeat that. Pain is a request for change. A request from what? Well, your cells, right? They're asking you, they usually ask you nicely in the beginning, I need you to change something. What do they want you to change? A habit or a behavior. That's what they want you to change. Right? And if you don't listen, or you just treat the side of pain and you do same old, they're not going to be as nice in their request. Then they're going to be nasty. Then they're going to hurt you. And they're going to make it, hurt, and then they're not going to make it stop.
Yeah. Take you to your knees, literally.
Yeah. And then it's just like a tap on the shoulder at first. And the next time they're going to punch you in the gut. And you need to change something up. And it doesn't have to be a big change either. That's the thing. I mean, people think it has to be some huge thing that they need to do. Sometimes it's a matter of, dude, all you got to do is drink more water and sleep more, and you'll probably be really, really good.
Yep.
And then you're like, that's it? Yeah.
You'll
that's
see
probably
massive improvements.
Yeah. So it's non-linear, these results, you know. So if you do A on something you need, it doesn't mean you're just going to go to B. If you do A, like with hydration, you can go all the way to Z like that. And to go, because people who have chronic autoimmune disease, they're dehydrated. I don't care how much water they're drinking, they're dehydrated. They're not able to absorb it. And then that's also a lymphatic issue, because that's going to change the concentration and the fluid around the cell, and whether the cell can absorb the nutrients or not, or absorb the water. And so all of those little factors can make a huge difference. So it's usually a very simple thing that gets overlooked, because we feel that if somebody's that sick, it can't be that simple. It's got to be complicated.
Right.
But the human body is complex, but it's not complicated. It only gets complicated if you don't understand how the systems work together.
And interplay.
And when you break it down into parts and you specialize, right, it seems complicated. But it's really not. And that's actually one of the weapons that medicine uses, is complicating things. Because if they complicate things, it makes them appear that you need them more, that you can't figure it out on your own. And I'm like, you want to bet? I got the same damn books you got, right?
Yeah.
Especially now with the internet. And so it's a reframe of looking at how these things function together, because the more you specialize, the more you know about less and less, like that way. And then I had a guest on my podcast once named Dr. Zach Butch, who's a medical doctor, and he said he found that medicine rules behavior through two primary emotions, fear and guilt. So they'll scare the living hell out of you to get you to do something because you'll fear that of what'll happen if you don't do it.
Right.
And then if you don't do it, then they'll guilt you into doing it. Right. And all you got to do right now is just take a look at what's happening with COVID. And there's your answer. You got both of those going. Fear and guilt, they're the primary drivers of human behavior right now with this pandemic. 100%. Not education. It's not education. It's fear and guilt.
Yeah. 100%. Yeah, we could go down a rabbit hole with that one.
Big hole. We're not going there though. Let's stay back with lymph.
So we kind of touched on a few of the practical things, categorically, but what are some of the things that you're doing so you offer some classes. I do remember seeing in around the physical manipulation, I guess a little bit along the lines of chiropractic and the soft tissue. So maybe you can explain the soft tissue piece of it.
I'm not sure I know what you mean in relationship to.
Well, you mentioned the body aquarium, and then I think I've seen some videos of you working manipulation with clients on kind of flushing the system.
Oh, yeah. So, you can work on, I'm a lot with hands-on. Like most of my stuff is really, really intensive assessment. Like easily 90 minutes, 2 hours. Like I spent a lot of time with you because I've designed my practice that way, where I'm going to touch pretty much every square inch of your body and then talk to you a lot. So I'm going to assess these areas where people get a lot of the tightness or restrictions in these lymphatic channels, because there's key areas that you need to look at. Most of them will reside around the largest joints in the body that need to move a lot, like the neck, the shoulders, the hips, the knees, and the abdomen. So nature's not stupid. She knows that movement moves lymph. So she puts the big clusters of what's called lymph nodes, and they're the end point of the lymph where your immune system comes in and kills. It's like 600 small little kidneys around your body that are designed to filter and kill things. And she put them in areas that move a lot. Top of the neck, bottom of the neck, shoulders, joints, knees, torso. Or let me clarify that, are supposed to move a lot, not sit in one position all the time.
Yeah.
So I'll check those regions and I just free those regions up. And it just so happens that those node clusters gather around big restriction points in nerves and blood flow at the same time. So they all coalesce together right there of what I call tribal gatherings. Tribal means a community that gathers together. And those big areas of the tribe make decisions that influence every other member of the tribe. And then I look at major vascular points in the body, what we call pulse points. So I check over 50 points on the body for tightness or restriction, and whether I can feel a pulse or not beneath my fingers. And so that lets me know one simple thing. I mean, how well are the fluids that need to supply your body with nutrients and get rid of waste actually working? Because I put a post up on Instagram before we got on the show that I consider lymphatics and blood a type of connective tissue, just like fascia, just like ligaments. So I treat them the same way. And I look for snags, blocks, restrictions. And just like connective tissue, if you have a restriction in one place, so let me say for an example, if you have a restriction in movement in the ligaments or the connective tissue in your ankle, then that's going to decrease motion that could be available to you, which means your body has to adapt to that. And that can lead you to have hip problems on the same side, or it can give you shoulder problems on the opposite side, or it can give you problems any damn place it wants to, right? So, because the body can do whatever the hell it wants to do. But the same will hold true for a lymph restriction or a blood flow restriction. So one of the major places that you have a pulse point is in your ankle. So if I have a restriction of a pulse point in my ankle, usually on the inside of the ankle, near the heel, and if it's not strong, if it's weak, I know you have an issue with blood flow. And if you have an issue with blood flow there, that's a pressure differential. And then your body has to make up for that loss of pressure somewhere. And then I just have to check and see where it might be. So I'll find the same thing where that restriction in blood flow in that ankle can be tied to an issue just like the ligament in the ankle. So what I'm trying to do is expand people when they're looking at tissue to not just focus on muscle, fascia, ligament, joint that we're used to.
Right.
Focus on the other things. So that's what was with me. So let me give you an example. Like one of the major areas where you have clusters of lymph nodes and blood flow restriction is in the shoulder joint where the shoulder comes into the pectoral muscle. So when you round your back and you hunch forward and you roll your shoulders in when you have poor posture or you're under stress, right? You curl into a ball.
Right.
It gets tight here. And then you could go in and get a massage, or I'm going to put a ball or a vibration tool or a roller, or I'm just going to press on my pectoralis major and pec minor. So now I would be doing that before, but now here's what I'm thinking. Now I'm thinking about blood flow and fluid flow and lymphatic flow underneath that tissue. And then how that here has to relate to the other areas of the body where you have fluid, lymph, and blood flow.
Okay.
Right? So for me, I'll still release it like I would, but now I'm envisioning there's a lymph node there that's going to be an issue. If it's painful here, your lymph's going to be involved, because when you have pain, you have inflammation. And then the one system that's designed to get rid of inflammation is the lymphatic system, right? Because inflammation is an immune system response.
Okay, right.
And so the lymphatics are designed to get rid of that. So are your veins. They're designed to get rid of inflammation. So then I need to make sure that that inflammation can flow out and get back to its end target. Where's the end target? Same place it's always been, base of the neck, right? And then back to the heart. Then the heart has to send it out again. It has to send it out again.
Yeah.
So then you have to look at not only how the shoulder is going to be for going back to the heart, but of coming out of the heart. So one of the big relationships that I always look at is I have to check the right shoulder compared to the left shoulder in relationship to how the lymph nodes feel and how the pulse feels in right shoulder to left shoulder. And very often you'll find a difference where the pulse can be higher on the right or lower on the right. It can be either one, because you can, here's the thing with your body, that you can get pain from not enough blood flow and you can get pain from too much blood flow.
Yeah. It's somewhere in the middle.
Yeah. I mean, it's a Goldilocks syndrome, right? So there's what I do. Then I have to balance the flow points. So it's not just decreased blood flow, but increased blood flow called hyperemia, which can happen as well. So when you begin to reset and think like that, so it's a change of concept really from here that I'm trying to really teach people, right? And so most of my work will always check those primary areas, and I always spend a lot of time in the abdomen.
And the abdomen? Oh, yeah, that's right. Because you said, what, 70%?
Yeah. So you have 70 to 80% of your immune system resides in the abdomen, but also you have the largest blood flow in your abdomen and your aorta. So that's the big dog right there, that guy. And then you also have the largest lymph node in your body at the same time, right in the abdomen. That you can have a compromise in the aorta. You can have a compromise in the largest lymph node in the body called the cisterna chyli. And then that sits right next to the vena cava, which is the big vein bringing stuff back up towards the heart. So they all run side by side, the three together, like
it's like a three-lane
third
highway
rail, like
yeah,
that's way. And if you have a problem with one, you usually have a problem with the other two because they always go together. So if you have a compromise there or a blockage there, then you'll notice it somewhere else. You usually won't notice it there. You'll notice it somewhere else.
Yeah, the symptom is somewhere else.
Yes.
You know, you're talking about fluid. It makes me think of like water damage in a house. Where the water damage is isn't necessarily where it's coming from.
That is correct. Yes, sir. Exactly. Great analogy. Yep. That's exactly how you have to think. It can be far removed from, and that's where medicine gets lost because we're so focused in on tissue damage on a site of pain. And we now know through the research in pain science that tissue damage does not correlate to pain at all. That a lot of people can have tissue derangement or something that shows up on an MRI and they're like, well, thanks for letting me know. I don't feel any issues at all. And then some people are like, I can't find anything on anything, but they can't move. Right? So there's zero correlation between structure damage and the level of pain that somebody feels.
Wow.
But in medicine, when we find that, that's what we go after. And that's got to be it. You see it a lot with the lower back. I mean, we found 2 herniations in your lower back. I'm like, that's nice, but that doesn't mean that's causing my low back pain at all. But I'm not saying it doesn't, but the majority of the time it does not. It usually is coming from another region. For me, it's in the front, but there's a lot of other multifactorial stuff in relationship to lower back pain. But that in and of itself can cause to have more pain. So when you know you have a disc herniation, then that amplifies your pain. Then that's what you keep going to all the time. And then you just automatically manifest the symptoms of knowing you have a disc herniation. So it's a self-fulfilling prophecy in relationship to that. So when you look at the stats of, especially with shoulder injuries, yeah, most people are walking around with a rotator cuff tear and they have no idea.
Well, I was just going to say, it almost seems like in that case, lack of a better term, ignorance might be bliss in that moment, because when you become aware of it, you then emphasize.
I actually agree with you that it absolutely. So you have to be careful of the words that you use to communicate with people.
Yeah.
These days, because words can make you sick or they can make you better. Absolutely, no doubt, right? And so people become their label, they become their diagnosis, and Absolutely. Then God forbid you get on Dr. Google and then you end up with like a swollen knee, and the next thing you know, you got dengue fever from like Nigeria, and you never been there before, but you're sure you got it.
Yep.
So it's you go out of control like that, and then that's not good. That's not good. It doesn't mean you shouldn't be educated, but you also just know that because something says that you have this showing up on a test doesn't mean that that's actually I see it all the time, man. All the time.
Well, I mean, it kind of circles back to one of the points earlier, and I've had multiple conversations on personalized medicine, is understanding your own personal baseline. Like, we take all these numbers in science and medicine to make these averages across millions of people, but your 98.6 for you might be a fever, 98.6 for me might be normal for, for temperature. So it's kind of hard to assess, and you have to use these generalized numbers, but, it doesn't necessarily apply to you direcally.
That is very true. Yeah. I mean, that's why they have this range as well, but you could be in the normal range, but on the low end, but maybe you actually would feel better if you were in the normal range, but a little bit better on the higher end.
Yeah.
Right. So there's a spectrum that has to come into play there. Yeah. But how many people have you heard of? I see it all the time, that they feel really sick and ill, and nothing shows up abnormal on blood work.
Yeah. Yep. And then
It happens all the time.
All the time. And it's like, so I'm supposed to just kind of.
Well, the gold standard is the blood stuff, right? But even that's arbitrary because of how they discovered, how they got you that number. But listen, the body will do anything and everything humanly possible to try to keep your blood as clean as possible. Like, you've got to be horrifically sick, in my opinion, for something you got to be at a bad spot for something to show up in your blood.
So that's kind of the tail end of the assessment, you think? Like,
yeah, they'll usually feel it a lot of other places because the body's going to say, dude, we got to keep the blood as good as we can, because that's the life blood. They call it that for a reason. If something shows up there, you've had something for a long time. Like liver enzymes. If liver enzymes show up in there, your liver's been getting hit a lot for a long period of time, and then it manifested in the enzymes.
Wow.
That's got to be significant issues with your liver for that to show up.
That I had not heard of. I mean, I've heard that, blood test is an incomplete view, but hadn't thought about it from the context that that's probably further down the list in really understanding your current state.
Yeah, it's not the first thing you get. It's towards the end.
Wow.
Yep. Or you've had it for a while before it manifests itself, because the body has this, it's got checks and balances and adaptations and clearances. And when you step back and you look at your organs, you're like, okay, well, why the hell did Mother Nature, or whatever you believe in, give me all these damn organs? Like, what the hell are they for? Most of them are to detoxify things, to clean you out. That's what they're there for, right? A lot of them. Your skin being a big one. And you're really toxic all the time, and that's why nature gave you a lot of stuff to help you. And if something goes wrong with one system, it's by design. Another one says, no worries, man. If you can't pull your weight, I'll step it up in the skin for you, right? Another one comes up from here, and then it just like follows down the line until eventually it can't compensate anymore. It can't adapt anymore. And then that's when it's going to show you those physical symptoms of, I need some help. And then all of a sudden you wake up one day and you got a rash on your damn arm that wasn't there yesterday.
Right. So if you got eczema, you've got something deep down in the bowels.
Yes. Yeah. You've got issues, absolutely, with your gut, your liver, and your lymph. Probably all three. Because every single one, your liver and your lymph your liver and your gut are significant players with lymphatics, as well as the skin. So if your liver is overburdened and your gut is leaky or malabsorbed, then you're going to leak stuff through your skin. And then you got to manifest it on the skin anywhere it wants. Right. And it's also not by accident that many people get stuff on the face and the neck when they get those breakouts.
Yeah.
That's just most of your lymph nodes. You got 600 to 700 lymph nodes in your body, depending on the resources that you look at and the size of you as a human. 600 to 700 of those lymph nodes that are designed to kill things. 1/3 of that number, I just want you to contemplate this for a moment. 1/3 of that number is from the neck up.
Wow.
So what does that tell you? That it's probably really important to purify the neck and the brain, right? And the nerves around your face called cranial nerves. And it just so happens when you look at how lymph drains in the brain, it drains along cranial nerves that are in your brain.
So is that cranial sacral therapy?
That's the type of one that you can do. I do a lot of that. That's looking at how the cranium, the skull, works in conjunction with your sacrum, which is your tailbone, when you breathe. So when you breathe in and out through your diaphragm, you actually change pressure in the body, and that pressure moves muscle, which moves bones. And then, so it has a pumping mechanism from the tailbone to the skull, and then the spinal cord shortens and lengthens in between. And it moves this fluid called cerebrospinal fluid, so around the brain and around the spinal cord. And now they're finding that the cerebrospinal fluid is a major detoxifier of the brain. It power washes the brain at night when you sleep. That's usually what it does. And it, over the course, it'll power wash 3 pounds of waste a year from your brain if it works well.
3 pounds? Wow.
Now imagine if it doesn't work well.
Yeah, that's a lot of unnecessary gunk in your system.
Yeah, especially in your brain. Then you're going to get neurodegenerative disorders, right? That's what they tie to Alzheimer's, that amyloid plaque protein, right?
Alzheimer's and, what is foggy brain and...
That's what I had. The biggest thing that I had for me that was the most scary was, listen, I can deal with physical pain. It sucks, but man, I can push through it. But what scared the hell out of me is when I lost my ability to think, when I lost my brain. I was so tired all the time and I couldn't remember things that I just said. I actually started to forget names, like my kids' names.
Yeah.
I forget what I just did.
Yeah, you couldn't recall.
It just wasn't there.
Yeah.
I mean, that's just like Alzheimer's. I was heading into that just degeneration. I tell the story all the time that I knew I needed help when I went to the post office to mail a package to one of my online members. Went in, mailed it, came back out, got to the car, was in my car. I'm like, all right, lost my keys. I mean, how often do you misplace things, right? You forget things.
Yeah.
Looked in my seat, looked in here, stepped out, followed my traces all the way back, went inside, asked the post office, did anybody turn any keys? No. And I'm like, oh, the hell. So then I rechecked everything, of course, right? And then about 10 feet from my car, I actually stopped and I noticed that my car was running. So what that means is this. I started my car, but didn't remember I started my car. I didn't have the environmental sensory awareness to hear the car or notice the car. Left the car, then came back and then noticed it. And people say, how's that possible? Well, that's what Alzheimer's is. You just can't, your brain can't wire and fire. And it's the scariest thing in the world when you start to lose your brain.
Yep.
And that's when I knew I needed help. And then not to mention that over the course of my illness, I packed on 30 pounds of inflammation and fat. And here's the beautiful thing. When I started to work the system, within 1 month, I was like 80% better and I lost 30 pounds.
Wow.
And it was just because my body got rid of all the fluid that it was using to try to protect me with the inflammation. And so I lost inflammation and fluid that was surrounding the cells. And then I lost the body fat that my body put down to try to handle the excess toxin load, because your body will deposit fat in order to protect you from toxins in the body, because the fat is also an organ and it'll deposit fat as a toxin removal system, and it'll hold the toxins in the body fat. And it's very, very difficult to lose body fat, because if you can't handle toxins, then the body's not going to let you burn body fat to release more toxins into a system that can't handle toxins. So it keeps you fat to keep you safe.
Wow.
So one of the reasons that people can't lose weight is because of an excess toxicity in the system from lymphatics and a stagnated, congested liver. And they end up getting metabolic syndromes where they have issues with glucose and insulin and pancreatic enzymes and bile and all sorts of stuff. So it's a cascade that goes. So my running kind of like joke is that most people, they don't even care about lymph until I tell them, if you work your lymph, you probably lose about 5 pounds like that. Then I'll go, really? I think I'll try it, right? Like, that vanity comes into play. But listen, I've been a bodybuilder since I was 14 years old. I know anything and everything about fitness and about nutrition, but I could still not lose the weight or the puffiness. I look like a big, giant, swollen marshmallow. I look like, if you know the Ghostbusters movie, the Stay Puft Marshmallow Man.
Yep.
I was like, who is this guy in the pictures? That's not me. And then, when I started to work the lymph and do the system, then I really trimmed down, and people were like, wow, you look so different. Right. And then That's because my body allowed me to get rid of the swelling and the inflammation. So you have to
working right.
You have to kind of think it's okay. You're doing all these things to heal the body, but is the body ready to accept the healing that you're trying to give it? If it's not, then you're going to struggle. So that's why I started to, instead of looking at the therapies that I'm doing, which are important, I started to look at the order in which I began to do the therapies, and how much of them I did was more important than the actual therapy itself.
So really understanding the individual, even circling back to a thing that we touched on very briefly, but even mindset and their ability to absorb the process.
Right. Yeah. It's a lot of different factors that go into it. So that one, a key phrase that I read, I studied osteopathic medicine a lot because they were one of the pioneers in trying to do something about lymph. It's like, hey, it's great you got a lymphatic system, but what the hell do I do with it? And these guys were one of the pioneers on that. And they said a phrase that it took me a while to unpack it, but it made so much sense when I began to do it. It said drainage precedes supply. Drainage precedes supply. So let's break it down. Precedes mean has to come before, right?
Right.
What does drainage mean? Drainage means I have to work and remove toxins, or work the vascular system and the blood system, because they're the main drainage systems of toxins from the body, right? Have to do that before I work on supplying the nutrients and the oxygen that comes in second. So that means, in my world, one thing: lymphatic work always comes first. So I work the lymphatics first, then I do everything else. So if you get the drainage down, then the supply part is much easier. But if you don't get that down, supply part is going to struggle or not happen at all. Right?
Yeah, it's going to be, wow, that's amazing.
That makes sense?
Yeah, it does. It does.
So you can't, that's what we're doing in medicine, is we're trying to supply everything first.
Yeah.
Right?
Yeah. That makes perfect sense.
But you can't do it in that order. I mean, you can, but you're not going to get the same results.
Well, but I mean, it's like filling up a cup that's already full, just with the wrong stuff.
Exactly.
So you got to empty out.
It's just it's a small shift, but it's a dynamic, enormous. I'm going to make up a word. Shift of the results that you can get. And sometimes it's just that simple. It's like moving one piece on the chessboard can make all the difference. And that's what it is when you're trying to work with somebody. It's a game of chess. It's a game of being a detective and figuring out, why did the body do the moves that it chose to do? Right?
Yeah.
And when you begin to think like your body instead of a research paper, because your body doesn't think like a research paper. Your body thinks like a cohesive unit with one job. The body has one job, and it's not happiness and joy. It's don't die. That's its job, right? Don't die today, and please try to not have pain today, and conserve as much energy as you can along the way, and then I'll be really happy. And then, of course, try to procreate is on the other end of that. But so if you know the goal is survival and don't die, and then you look at what the body does, it all starts to make sense. Right?
Yeah. I feel like we could spend another hour easily talking about all this.
Yeah. Oh, at least. Yeah. No worries. Yeah. We're good.
I mean, obviously we could probably spend years talking about it, but
yeah, I plan on it. Yeah.
Well, good. I appreciate your time. We're kind of over the allotted scheduled time, but I really enjoyed the conversation. It was very educational for me. Hopefully, I'm sure for those listening. But I'm like ready to make an appointment and head head home to the motherland in New Jersey to make an appointment based on some of the things you said. But what I like to do when I close things out is ask a few questions of you personally, if that's all right.
Oh, I don't know if I studied, but I'll try.
All right. All right. What are you reading right now?
Holy cow. Well, I don't read one thing at a time. I read like 6 books at once.
Best way to go.
Hold on. Let me bring up my Kindle and I'll let you know what I'm hitting. I am like an avid reader.
That's one thing that I've been getting better at. Thankfully, Audible exists. So I've been able to consume a lot more of content.
Yeah, that's great. Yeah. I'm reading, I'll give you 3 that I'm reading right now. All right. One is by a guy I just had on my podcast, Dr. Gerald Pollack. It's called The Fourth Phase of Water. Fourth Phase of Water. One of the best books you'll ever read. It's going to talk about water and absorption and healing.
Okay.
Then another one I'm looking at is by my good friend, Coach Dan John, 40 Years with a Whistle. So he's a track and field coach, and he's got a lot of life lessons in there. 40 Years with a Whistle.
I'll definitely check that one out.
Yeah, that's a really, really good one. And the other one I'm reading is, where did it go? Yeah. Oh, here it is. Okay. Yeah. I just got to get the cover so I can. It's called let me get the cover here. Hold on. I'll find it. I'll get you. So many different things that you can cover. Yeah. It's called The Other Brain by Douglas Fields. The Other Brain. And it's talking about dementia and schizophrenia and the role of astrocytes and glial cells in the brain in relationship to pain and autoimmune disease. It's quite fascinating. Yeah. So awesome. The Other Brain by Douglas Fields. That's a good one.
Great. Thank you.
One of my favorites, that one.
Next one is, what are you listening to right now? Music.
Well, I'm a huge disco fan, man. So I've always got disco rolled up in my phone. You'll always find a little bit of Earth, Wind, and Fire and Bee Gees in there. Nice. But I also mix that with the era that I grew up in, which was hair metal bands of the 80s. So you'll hear Earth, Wind, and Fire, and then you'll hear Winger right after that.
Winger. Awesome. That's great. So what is your go-to rest and recovery method?
Well, I like active rest. I love to walk. I walk 10,000 steps every day without question. So hanging around my neck is a pedometer.
Okay.
That I always check. And if I don't get 10,000 steps, I walk around my house or march in place till I get it. So that's my goal. And that's awesome. Made a significant and profound difference in my life. And the other one is I love Tai Chi and Qigong. So I do a lot of the internal type of martial arts. So that is a form of meditation for me. I don't do well with stillness meditation.
Yeah.
I like to have fluid flow, circular motions, and movement with my meditation, and Tai Chi and Qigong are probably my go-tos for that.
Awesome. Well, Dr. Perry, again, I am super grateful for your time and insight and wisdom, and I will definitely be continuing to follow your work and helping support in any way possible, because I'm a firm believer in a lot of the things you're talking about.
Well, thank you very much. I really appreciate that. I've enjoyed coming on. Thank you for giving me the opportunity to discuss my journey and my love for what I do. Hopefully it resonates or connects with a couple of people out there, and then they can realize that, listen, there's always hope out there, and that just because you don't have an answer right now doesn't mean that there isn't one. And maybe listening to me, you can realize that even though it might seem like a crazy approach, it probably not. It probably means you're on the right track. You'll forge a new path for yourself or for someone else.
Yeah, it just might be crazy enough to do, right?
Well, somebody's got to do it, man. Right?
Yeah.
I mean, you got to, if you want to make a difference in the world, I mean, you're not going to be doing it by being like everybody else. That ain't going to happen. So you're going to have to follow your own path. It's not easy to do that because a lot of people don't want you to do that, but that's what we need. I'm a big Steve Jobs fan, because of just his whole philosophy on things. And he said somebody said, what's your goal in life? He said, I want to make a ding in the universe. And I think he did.
Yeah, he did. He definitely did.
So that's a nice goal.
I would say so. Well, sir, thank you so much for your time.
Yeah, you bet.